This is Dr. Patrick Hu, CEO of Moffitt Cancer Center. We're so excited to come to you from Orlando, Florida at the annual AACR meeting. We're here with Dr. Shelley Tworoger, the Associate Center Director for Population Sciences. So thanks so much, Shelley, for being here with us today.
Thank you for inviting me. It's a pleasure to be here.
So you're chairing a session. Tell me about that.
Yeah, so I'm chairing a session looking about how we can leverage bioinformatics techniques and animal model techniques to design new combination drug treatments for cancer. So it's a little bit out of what I usually do, but there's a lot of really interesting work that is being done leveraging, for example, whole genome sequencing and tumor sequencing, as well as novel bioinformatics techniques to understand who might be resistant to cancer and to also design combinatory treatments that may work well for cancer patients that are more targeted to their specific context.
So a lot of people know about if you're targeting one mutation, like the BRAF mutation, you're going to give a pill to inhibit that pathway, right?
Right.
But what you're talking about is a more global look at both the DNA that's in the cancer as well as the DNA that we inherited from our parents called the germline DNA. So you're looking at both of those, right?
So both of those, as well as the immune context, so how the immune cells are interacting with the cancer is another important thing that's being looked at in these. And they're also looking at different approaches of how, say, two different drugs that target a specific mutation that one tumor may have both, how they could be additive in their effect, or whether they might be synergistic, whether they might have a bigger effect than any one on their own, or if you just add the two together. So I think that's a really cool opportunity for us to find drugs that together work better than each one might work on its own.
Even in the same pathway or different pathways?
Even in different pathways.
I see.
So both in the same and in different pathways.
I see. Fantastic. So it's really a lot of data and information, right? Because you're talking about drugs, you're talking about mutations of the tumor, you're talking about the immune microenvironment, as well as our germline DNA that we inherited from our parents. And so really is a lot of information. So how is that all processed informatically?
Yeah, so it's really cool. People are building these very well annotated databases. I think database is even too light of a term. They're really whole platforms that then you can plug in your mutation of interest or the type of cancer that you want to look at, and it'll output results from hundreds of clinical trials around the country. And so it allows you to look both at the same drug across multiple cancers, or within one cancer, multiple different drugs. So I think more and more of these platforms are being developed that take data from human clinical trials, but also data from more basic science work on cell lines or using animals to combine those two things together to really get the best prediction for each patient.
So project into the future, what are we looking at? Are patients going to come, we're going to, of course, sequence their tumors, but we're going to probably sequence their germline DNA and look at their immune cells in the tumor, and then is AI going to tell us what then the combination of therapy that we're going to use?
Maybe. I think it's going to be a combination of AI and experimental models, but I just want to throw in from my population science hat that I think we also need to be thinking about combination treatments that are lifestyle based. For example, physical activity has been shown for several different cancer types to be really important in improving outcomes, not just how people feel from their treatment, but actually improving their long-term survival. So I would like to see the next step really taking these precision medical treatments and being added on with other kinds of lifestyle or behavioral factors that patients can do themselves to improve their outcomes.
Absolutely. For prevention, for example, is it more exercise? Is it more diet? Or how do those things interact? But also when patients are on treatment.
That's right.
Because that's really the most common question I get as a physician is, what should I eat?
Yeah.
And there are some interesting studies of, for example, fasting and treatments and how that affects different kinds of treatments.
Exactly. So there have been some studies about something called intermittent fasting. So you don't fast for long periods of time, say days, but rather you might not eat, say from 6 p.m. to 9 a.m. the next day. And each day you would have this period of fasting. There's still a lot of, most of the studies out there about this are pretty small, but there are some data to suggest that it can improve your immune function and also improve things like growth hormones that can cause cancer to grow. I think that's an important area of research. So it's not only about what you eat, but it's about how you eat it and when you eat it. So there's a lot more that needs to be done in that space. I would say the most well-established thing for cancer patients undergoing treatment is physical activity. Both, modest activity like walking briskly. You don't have to go run a marathon to get the benefits. You just need to be out there walking briskly for 30 minutes a day. And then resistance training. So that can be an important thing because a lot of patients experience muscle loss due to their treatment and to the cancer itself. And so that can help your body stay strong and actually also still help with your metabolism as well, and potentially helping your body's own metabolism and immune system fight the cancer.
I see. So it's both aerobic activity like walking as well as lifting weights. And trying to build up your muscles or maintain your muscle function.
Exactly.
I can tell you one way to get your walking is to come to AACR, because if you want to go from one session to the other, there's a lot of walking.
Oh yeah, everyone's getting way more steps than they usually do when they're at work sitting in front of their computer on Zoom meetings all day, for sure.
That's right. Well, Dr. Shelley Tworoger, Head of Population Sciences at Moffitt Cancer Center, thanks so much for joining us today.
Thank you for having me.